A lot of people are like, okay, I have trouble sleeping, insomnia, blah, blah, blah. It seems almost like everybody's always talking about the struggle with sleep. What's the one fact about insomnia that would shock most people in your mind?
Yeah, I think it's probably the fact that insomnia is really defined by the amount of time you are awake when you're trying to sleep, not how much sleep you actually get. So if you look at the criteria for insomnia, like total sleep time, the amount of sleep you get isn't actually in it. And actually, I think that's an important message to patients because it really sets the stage for how we do CBT-I because we're really trying to reduce wakefulness when you're trying to sleep. And I think that cognitive shift is actually quite helpful for setting the stage because people are so used to trying to get more and more sleep, but oftentimes the more you try, the more effort you put into it, the harder it is to get it. So if you shift it so that you're trying to reduce wakefulness, now that's much more doable. And then that sets the stage for why these things work because now you're like, oh, okay, I can do something about cutting down the amount of time I'm awake, whether it's time falling asleep or time asleep in the middle of the night. And that's much more doable and achievable than it is just to try to generate more sleep because that doesn't always, I mean, there's some indirect ways to make that happen, but you can't directly make that happen.
I feel like there's an overemphasis in the general public kind of arena talking about sleep hygiene and if I do all these things then my sleep's going to get better. The flip side is I feel like in the world of sleep medicine, sleep hygiene's almost like poo-pooed or villainized to a certain extent. And I look at it as just being in the spectrum and part of that cognitive behavioral therapy. So can you kind of talk about what we mean by sleep hygiene and how that intersects with what you're doing with cognitive behavioral therapy?
Yeah, that's a great question. I mean, sleep hygiene, it's a term that the media and the general public likes it because it seems to be a sexy term. But just so we're clear in terms of what it means, I mean, typically these are things that you can do, kind of lifestyle, managing the environment, like temperature, things related to like food, beverages, like drinking coffee late, things like that. So what it ends up being is just like a list of things that would otherwise be detrimental to your sleep, right? So it's to give yourself like the best chance to have sleep. Sometimes I make the analogy to like dental hygiene. Brushing and flossing, that's important to do on a regular basis because if you do that regularly, you stand a better chance to prevent cavities, right? That's good dental health. But if you have a cavity, brushing and flossing is not going to get rid of that cavity, right? For people who maybe have occasional sleep disturbance, or interestingly, sometimes I find people with other sleep disturbances and sleep disorders besides insomnia actually have poor sleep hygiene, meaning there's things that they're doing that are basically shooting themselves in the foot. And so they're not really giving themselves a fair chance to have good sleep. But people who have especially chronic insomnia, they're beyond that. They're like, in my analogy, they're the person with a cavity. So here, sleep hygiene isn't really going to, get rid of the cavity. It's not going to solve your chronic insomnia. That's sort of the way I like to explain it to people. Yeah, these are probably things that are helpful from sort of a sleep health perspective. But if you have a sleep disorder, especially chronic insomnia, and studies have shown that sleep hygiene really is not an effective treatment for chronic insomnia. In fact, we oftentimes use it as a control group when we're studying it, especially when you compare it to other behavioral strategies. So that's how little we think of sleep hygiene, at least as an intervention for chronic insomnia.
I love that distinction because it's not that it's not helpful. It's that you've now crossed over to it being something that has less utility. So,
That's right.
what does have utility? When you're developing Somrest, what are some of the just broad key components that people can expect going through a program like Somrest?
The core components really are our behavioral strategies. So there's a technique called sleep restriction. Now, I don't love that term because that sounds punitive and people think of it as sleep deprivation. And while it's true, you may get somewhat less sleep as you're going through it, the idea is actually reducing your time in bed. So probably a better term for it would be bed restriction, if you will, meaning you're limiting the amount of time that you're spending in bed. And it's very counterintuitive, right? Most people who have sleep issues, they want to cast a wider net. They want to spend more time in bed. But what they don't realize, and the reason why this is so powerful is because spending less time in bed actually helps to promote the systems in your brain that generate sleep. So this is all based on the science of sleep, how we understand sleep is regulated. One of the mechanisms that regulates sleep is what we call a sleep appetite. At least that's the way I like to explain it, because it really is a drive that increases with the amount of time that you don't have sleep. It's just that we have a term for the time that you don't have sleep. It's called being awake. That's what most of us live for. I draw analogies because I think that this makes it more relatable. Like food, that's another area where there's a drive. And if you have a meal, every amount of time that goes by without eating, you are going to get more and more hungry. Now, you're probably not going to feel this until like 2 or 3 hours after you ate your last meal. However, this is a biological drive that increases with the amount of time without food. And sleep has a similar mechanism to where every amount of time that goes by without sleep, you actually build the same appetite for sleep. Okay, so in the case of food, you feel hungry. In the case of sleep, you feel sleepy. Right? That's a signal from your brain and your body that it needs sleep. So what the sleep restriction technique does is that temporarily it reduces the amount of time you're in bed to generate a higher appetite for sleep. And that's actually what promotes a greater likelihood to fall asleep faster and to stay asleep during the next sleep period. And if you do this consistently, you'll start to have less wakefulness. So again, that's why it's so important that your first goal in insomnia is to reduce wakefulness while you're in bed. And once you start getting that, then you regain the confidence that, oh, okay, there's something I can do about it. And then we start to expand that window for sleep, as we call it, that time in bed. And that's when you're going to start to get more sleep. Okay, so it's sort of a process that you have to take people through. And I'd say that's probably the most powerful component. Then the other main behavioral component is what we call stimulus control. This is what I like to call sleep reconditioning. And essentially, these are instructions for what to do if you're in bed and you're not sleepy, right? You can't fall asleep, you can't stay asleep. So this gives someone, these are the instructions that people hear about, like, if you haven't fallen asleep in 15 minutes, it's best to get out of bed, do something else. I de-emphasize the time because I think that just gets people thinking about like more, I've got to do this within a certain amount of time. So to me, it's just if you're laying in bed and you're no longer sleepy, because now you're relying on your biological signals, then that's a good time to get out of bed and go do something else. Usually that something else should be something that's kind of quiet and pleasant, something that isn't going to interfere with your ability to detect whether or not sleepiness is coming back.